Greetings. Let us learn about the classification of colon polyps. And what we will do is we will learn about the classification and then look at the various endoscopic pictures to assign that particular classification. This is a pedunculated polyp. As you can see here, there is a pedicle and this is the polyp. And this is a pedunculated polyp. And this is usually referred to as 1P according to the Paris classification. The Paris classification came up with the classification of various mucosal lesions and polyps. This is pedunculated polyp. Think about how do you keep remembering these different polyps. Think about a mushroom, and mushroom has a stalk, mushroom has a head. And when you try to hit on top of the mushroom with like a hammer and try to squeeze it down, and as the stages go, you will appreciate the classification or the Paris classification of polyps. So this is pedunculated polyp, and this is semi-pedunculated polyp. The stalk has become smaller. There is still a stalk, and there is a head. This is a semi-pedunculated polyp, otherwise referred to as 1S semi-P pedunculated polyp. And if you push it further down, it becomes a sessile polyp. That is 1S. Sessile polyp is any polyp where the height is more than the width. And the height is at least above the size of a biopsy forceps put on the mucosa. So whenever it is above that size, it is usually referred to as a sessile polyp. And when you press it down further, it is known as superficial elevated, otherwise referred to as 2A lesion, where the polyp is elevated above the mucosa, but it is less than the height of a biopsy forceps placed on the mucosa. When a superficial elevated polyp is larger than 10 millimeters, it is known as laterally spreading tumor. And if it has granular surface, it is known as laterally spreading tumor of the granular type. On the other hand, if it is smooth without granular surface, granular, smooth, it is known as laterally spreading tumor of the non-granular type. So, superficially elevated 2A, that is bigger than 10 millimeters, is known as laterally spreading tumor. And when the lesion is flat, just a tad bit or almost about the same level as the mucosa, it is known as a true flat lesion, otherwise known as 2B lesion. And when it is depressed, it is 2C lesion. When it is depressed and one of the edges is a little bit up, it is a mixed lesion where you call 2C slash 2C slash 2A. So we have learned about this. I want to go over this one more time in one picture. Here is the pedunculated polyp, 1P, semi-pedunculated polyp, 1SP, sessile polyp, 1S, superficial elevated, 2A, flat, 2B, depressed, 2C, mixed, 2C slash 2A. So this is an image that you need to learn so that when you see polyps, you can assign that Paris classification. Among all these lesions, depressed lesions and either alone or with a mixed pattern are the ones that we should worry more because they tend to have cancer. All these other lesions can be benign or may have cancer if their size is very big. But even small depressed lesions, you should worry about it because they tend to have advanced pathology and even cancer. Now let us look at with an endoscope. So this is a pedunculated polyp 1P, and here is the pedicle and this is the head. Here is the pedicle and this is the head. The precancerous area is all in the head, and if you cut the stalk, you will get rid of the polyp with a clear margin. So important to cut the polyp here rather than here, and if you leave some tissue, that will come back. So this is a pedunculated polyp. 1S or sessile polyp, so you can see it is protruding above. Height is more than the size of a biopsy forceps. This is a flat superficial elevated lesion, 2A lesion, as you can see, and it has granules, and it's a big one, more than 10 millimeters. It is a 2A lesion, more than 10 millimeters, granular surface, otherwise known as laterally spreading tumor of the granular type. On the other hand, here the lesion is smooth, and this is slightly elevated, that is laterally spreading tumor of the non-granular type. I don't have a 2C lesion to show you, but here is a 2C lesion with a little bit of 2A. This is the mixed lesion. I hope this is useful. Thank you.